I'm George Rust. I'm a professor at Florida State University College of Medicine and also director of the Center for Medicine and Public Health there. Well, the Southeast Regional Clinicians Network is a collaborative of all of the clinicians of federally qualified health centers in 8 southeastern states. And these are clinicians who work on the front lines caring for patients who often are not well served by the larger healthcare system. They may be uninsured or have Medicaid or for some other reason have been disenfranchised from the medical care system. They're characterized by having behavioral complexities and social complexities and medical complexities, and these clinicians are really expert on getting the best healthcare outcomes for those individuals and for their communities.
My name is Marty Wolf. I'm the Clinical Programs Director at the North Carolina Community Health Center Association. The community building between all of the people in the Southeast and bringing the clinicians and the PCA staff together so that we could figure out what we needed to do to improve the quality of care at our health centers. And again, it's bringing people together to share and learn from one another so that we're not always reinventing the wheel. So my call to action is very much about the transparency and promoting the community health centers so that people know who we are. I still find when I go into a lot of settings and I say I work with federally qualified health centers, people still go, who? So our call to action is to use our data and the care that we give to make people aware of who we are and what we do so that we improve care for everybody, not just the select few.
These community health centers are really on the front lines. They're doing the real world care and understand what the health needs are and understand what works in those settings. What they don't have is research capacity, the ability to test what they're doing and prove that it makes a difference with rigor, or to ask questions and prove them with enough academic rigor that other people will believe what they found.
Laura Makarov, I'm Senior Director of Cancer Control Intervention at the American Cancer Society. So research is powerful, and having engagement from all the stakeholders across the network is also powerful. The research can help both understand challenges that people are facing that may be common, as well as find solutions that could be used across the board and have broad uptake to improve care for everybody. It's also impactful as far as telling the story of the care that you're providing. So there's no other way to tell the story better than to have research be a part of your everyday and to be able to understand more about the common challenges that patients and providers are facing, as well as finding solutions together to help provide and support a better healthcare system for everybody.
And so bringing together Morehouse School of Medicine, the National Center for Primary Care, and the Southeast Regional Clinicians Network means that you now can bring the voices of these frontline clinicians to the academic space, to policymakers, to bringing rigor into the national conversation, but bringing voice that's relevant. Building the partnership with Morehouse helps them to begin to ask bigger picture questions and to speak to bigger audiences about what the needs are of their communities and what works in their communities to make those health outcomes better.